Hi everyone! Welcome to episode 6 of the Two Hands, One Heart Life Skills series. I am Jordan Welker, Miss Roanoke Valley's Outstanding Teen 2020. If you have not watched episodes 1 through 5, please watch those first to be able to accurately follow along with the series. As always, I want to state that I am an American Red Cross licensed CPR, AED, and first aid instructor, and this online series is not a formal certification course. My intent behind these videos is to give you a skill to practice and learn if you are in a situation where you may need to use this knowledge. Our topic for episode 6 is cardiac arrest and the cardiac chain of survival. This episode covers what cardiac arrest is and how to use the cardiac chain of survival to increase a person's chance at survival. Cardiac arrest occurs when the heart stops beating or beats too ineffectively to circulate blood to the brain and to other vital organs. Cardiac arrest happens suddenly without any signs and symptoms. It can occur because of cardiovascular disease, breathing emergencies such as drowning and choking, severe trauma, electric shock, and drug overdose. In children and infants, the most common causes of cardiac arrest are breathing emergencies, chest trauma, and congenital heart disease. Although a heart attack can lead to cardiac arrest, the two conditions are different. A person in cardiac arrest is not responsive, not breathing, and has no heartbeat. The cardiac chain of survival consists of 4 actions that, when taken, increase a person's chance of surviving cardiac arrest. Did you know 4 out of every 5 cardiac arrests in the United States happen outside the hospital? By completing the first 3 links in the cardiac chain of survival, responders can make the difference between life and death for a person in cardiac arrest. So, what are the 4 actions? The first is early recognition and early access to the EMS system. The sooner someone calls 911 or the local emergency number, the sooner EMS personnel will be able to take over. Second is CPR. CPR helps supply oxygen to the brain and other vital organs. This helps keep the victim alive until an AED is used or more advanced medical care is provided. Third is defibrillation. An electrical shock called defibrillation may help restore an effective heart rhythm. Last is advanced medical care. EMS personnel provide more advanced medical care and transport the victim to the hospital. For each minute CPR and defibrillation are delayed, the victim's chance for survival is reduced by about 10%. Cardiac arrest claims over 500,000 American lives annually and is not a condition that should be taken lightly. Hopefully you learned a new fact or two about cardiac arrest and the cardiac chain of survival. As always, if you have any questions about today's episode, leave a comment or send me a private message and I'd be happy to answer you. Thank you for watching and tune in next week for another episode. Stay safe and save lives.